Many countries have begun to mix and match vaccines, and they are administering them to people with 2 doses of separate coronavirus vaccines. Meaning, if your first dose is from AstraZeneca, the second dose becomes Moderna or Pfizer. The World Health Organization has now warned against these vaccine cocktails. But some of the world leaders have endorsed it, and among them is German Chancellor Angela Merkel and even Canada's Prime Minister Justin Trudeau. What's more, both these leaders have inoculated themselves with vaccine cocktails. So does this mix and match of vaccines, is it safe for use? Our next report has some answers. Take a look.
In Thailand, those who received a made-in-China vaccine as their first dose will now be given a second dose of AstraZeneca. In Canada, those who received the first dose of AstraZeneca will get a second dose of Pfizer-BioNTech or Moderna. This is called heterologous vaccination, meaning inoculating a person with a combination of different vaccines. In this case, a combination of different Wuhan virus vaccines. This is the new vaccination trend, and it is being endorsed for reasons various and many. Studies have ruled in favor of vaccine cocktails. The first study was published on the 18th of May. It says heterologous vaccination regimen is highly immunogenic, meaning vaccine cocktails produce high immune response. An Oxford study on mix and match vaccines found that Pfizer-BioNTech and Oxford-AstraZeneca generate strong immune response against Wuhan virus spike protein. This study was published in June 2021. Even before the month could end, German Chancellor Angela Merkel took a dose of AstraZeneca. Her first jab was a Moderna. Canada's Prime Minister Justin Trudeau took a shot of Moderna. His first dose was an AstraZeneca. Experts in Canada said mRNA vaccines could be used interchangeably. In July, STIKO, or the German Standing Committee on Vaccination, recommended mixing AstraZeneca vaccines with a booster dose of either Pfizer or Moderna. Contributing to the rising interest in mix and match is failure of certain vaccines, or Chinese vaccines if you may. Thailand announced mixing vaccines after over 600 of its medical workers were found infected with the Wuhan virus. This even after 2 doses of China's Sinovac vaccine. At least 1 nurse died of the Wuhan virus despite taking the Chinese vaccine. Something similar is playing out in Indonesia. Frontline workers are testing positive despite vaccination with Sinovac. Made-in-China vaccines are proving to be as bad as made-in-China toys. Experts are also endorsing vaccine cocktails to neutralize the Delta variant. A booster shot of mRNA is being recommended for those inoculated with a single-shot vaccine. Case in point, the Johnson & Johnson jab. There is no official recommendation from the CDC yet, and the World Health Organization is warning against vaccine cocktails.
So it's a little bit of a dangerous trend here.
Why is it dangerous again?
There is limited data on mix and match. There are studies going on. We need to wait for that, and maybe it will be a very good approach. But at the moment, we only have data on the AZ vaccine, Oxford AstraZeneca, followed by Pfizer.
The data on mixing Pfizer and AstraZeneca is positive. But we have nothing when it comes to mixing AstraZeneca with a Chinese vaccine. The failure of Chinese jabs is making countries like Thailand desperate.
It will be a chaotic situation in countries if citizens start, deciding when and who they should be taking a second or a third or a fourth dose.
Israel has started administering a 3rd dose of Pfizer. Canada is unlikely to turn back on vaccine cocktails. The WHO's waning credibility means that countries take their own calls. Plus, Chinese vaccines are forcing countries to look for alternatives. Ask Thailand. Bureau Report, WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.